Hello, I'm Dr. Bruce Randolph. I'm a physician specializing in wellness. I have a clinic called Rom's Total Wellness Clinic. And today I'd like to talk to you again on smoking. If you remember last time, we talked about the adverse effect of smoking in the general population, youth and elderly. Today, on our second documentary, we want to talk specifically about the effects of smoking on pregnant women and their babies, the fetus. Now, ladies, if you're pregnant, the worst thing you can do is smoke while you're pregnant. Let me ask you this question. What would you do? You have your newborn baby and someone came and blew cigarette smoke in your baby's face. You wouldn't like that at all, would you? And you wouldn't like that because of the adverse effect and harm that tobacco smoke can cause to your baby. Well, when you are smoking while you're pregnant, you are exposing your unborn baby to the same toxic effects. Cigarette smoke contains over 4,000 chemicals, in which 60 of those are cancer-causing chemicals. Now, the two chemicals that are most responsible for adverse effects associated with pregnancy are nicotine and carbon monoxide. Now, nicotine, which is a very addictive drug, but also it causes your blood vessels to constrict. Therefore, if you are pregnant and smoking, the nicotine that you take in from the cigarette gets into your bloodstream and causes the arteries going to your uterus to constrict. When the arteries go into your uterus constrict, that is, they get narrow, and instead of being wide, they close down. It's like squeezing a water hose. Then the blood does not flow to the placenta, and therefore your baby does not get the nutrients and oxygen it needs in order to grow as it should while in your uterus or your womb. The other thing about the cigarette smoke is carbon monoxide. As you well know, carbon monoxide can kill you. That's what happens if you happen to close your garage door and leave your car running. The carbon monoxide is what actually kills you, because what carbon monoxide does is that it binds to the red blood cells and keeps oxygen from attaching to it. So mothers, when you smoke and you are pregnant, then what you're doing is taking in carbon monoxide, which basically binds to your red blood cells and keep the oxygen from binding to it, therefore decreasing the oxygen that your baby needs in order to grow and develop. So as a consequence, babies born to mothers who smoke, one, they tend to have more complications. Secondly, they tend to be smaller than babies born to mothers who do not smoke. Thirdly, they tend to have premature birth, born too early, too maturely. And they tend to have problems with decreased growth. They tend to have problems with heart defects. Also, they have problems with breathing. They're more likely to have asthma and other lung problems. And lastly, they tend to die unexpectedly. You've heard of this thing called SIDS, sudden infant death syndrome. Well, infants born to mothers who smoke are at a much greater risk of SIDS than those who do not smoke. So mothers, if you really love your children as a true mother would, should, and do, then you would do the right thing. Don't smoke while you're pregnant. If you find yourself pregnant and you are a smoker, stop. There are many ways to stop. You can call 1-800-QUIT-NOW, and they can help you stop and help you ensure that you have a healthy baby. We will continue these documentaries. We're doing them in conjunction with and partnership with Future Builders, who have as one of their missions to help Arkansans stop smoking. This is Dr. Randolph. Until the next time we meet, you be blessed.